Hi, this is Swati, Assistant Professor, SNS College of Pharmacy and Health Sciences. Today we are going to see what is meant by sympatholytic agents. Before going into the content, we will see what are the topics we are going to cover in this topic. They are alpha adrenergic blockers and beta adrenergic blockers. In the alpha adrenergic blockers, we are going to see 6 types of drugs: tolozolone, phentolamine, phenoxybenzamine, prazosin, dihydroxyergotamine, methotrexate. And in beta adrenergic blockers, we are going to see the SAR of beta blockers: propranolol, metoprolol, atenolol, betoxazole, bisoprolol, esmolol, metoprolol, labetalol, and carvedilol. First, we will see what is mean by adrenergic antagonist, that is sympatholytic agent. Adrenergic antagonists are also called as adrenergic blocking agents, anti-adrenergic drugs. An anti-adrenergic agonist is a drug which is going to inhibit the functions of adrenergic receptors. There are 5 adrenergic receptors, which are those beta adrenergic receptors. In that, they are classified into beta 1, beta 2, and beta 3, and the second group is alpha adrenoreceptors. First, we see what is meant by sympatholytic agent. It is a medication that opposes the downstream effects of postganglionic nerve findings in effector organism innervated by the sympathetic nervous system. They are used as antihypertensive agents. Next, first we will see postganglionic neurons. In the ANS system, fibers from the ganglion to the effector organs are called postganglionic fibers. Postganglionic neurons are directly responsible for changes in the activity of the target organ via biochemical modulation and neurotransmitter release. Next, we will see the classification of adrenoreceptor antagonists. They are first classified into alpha blockers and beta blockers. This alpha blockers is again classified into 3 types: non-selective, alpha 1 selective, alpha 2 selective. In non-selective, it is again classified into irreversible and reversible. Example for irreversible is phenoxybenzamine, and for reversible phentolamine. Alpha 1 selective is prazosin, alpha 2 selective example is yohimbine. And the beta blockers are again classified into non-selective, beta 1 selective, and beta 2 selective. Non-selective example is propranolol, for beta 1 selective atenolol, and for beta 2 selective butoxamine. So the same classification here is repeated. Now we will see the therapeutic uses of the adrenergic antagonist. So they are used as pheochromocytoma. Pheochromocytoma means when stimulated, the tumor will secrete catecholamines in excess amount. It will cause intermittent or permanent persistent rise in blood pressure, tachycardia, and even cardiac arrhythmias. And it is also used for essential hypertension and used in the treatment of congestive heart failure, in peripheral vascular disease such as Burgers disease, Raynaud's syndrome, which is characterized by ischemic resulting from local anterior constriction, and in the treatment of hypertensive emergencies. And it is used in the treatment of hemorrhagic and end-toxic shock, in leakage of intravenous drip, for sensile cerebrovascular insufficiency, and the treatment of migraine, in the treatment of benign prostatic hyperplasia. And next, we will see the therapeutic uses of the beta adrenergic antagonist. It is primarily used in the treatment of myocardial infarction, angina, cardiac dysarrhythmias, heart failure, and hypertension. So it is used in angina. It is used as cardioprotective activity in irregular heart rhythms or dysarrhythmias, in hypertension, in migraine, and in glaucoma. Next, we will see the beta adrenergic blockers. This beta adrenergic blockers is classified into first generation non-selective beta blockers, second generation beta 1 selective beta blockers, third generation non-selective, that is alpha and beta blockers, and third generation beta 1 selective beta blockers with vasodilator. For first generation non-selective, examples are propranolol, timolol, nadolol, sotalol, pindolol, and levobutanol. And for second generation beta 1, there is cardioselective, atenolol, acylbutalol, bisoprolol, esmolol, metoprolol. Alpha and beta selective, carvedilol and labetalol. And beta 1 selective with vasodilator, betoxolol, nebivolol, and celiprolol. We will see the difference between alpha adrenergic antagonist and beta adrenergic antagonist. Alpha adrenergic antagonist means the substance which is going to relax muscle tissue in blood vessels and in the prostate gland, which is going to improve the flow of urine and blood. And beta adrenergic antagonists are used to treat high blood pressure, chest pain, abnormal heart rate, congestive heart failure, and several other conditions. Next, mechanism of action. Alpha blockers, which is going to lower blood pressure by keeping the hormone norepinephrine by tightening the muscles in the walls of smaller arteries and veins. Beta blockers work by blocking the effects of hormone epinephrine, which is also known as adrenaline. This is the action of alpha adrenergic antagonist and beta adrenergic antagonist. Thank you.